Moving on to our next topic, Parkinson's disease here. It is increasingly seen in aging Indian populations. How do you typically diagnose Parkinson's disease?
Parkinson's disease is clinical diagnosis, history, and observation. And it is actually very common, 1% over 60 years of age. And as the age increases, increase incidence of Parkinson's disease. And the global prevalence is almost 8.5 million people worldwide based on a study in 2019. So it's a significant effect. And almost 2.45 times more men are affected than women. The clinical diagnosis is important. Sometimes they come with difficulty walking or slowness, tremor. Most of the time, the tremor is the presenting symptom because it's more visible. Yeah. And family notice they are walking slow, and people, they are very in tune to their own body. They may come to you earlier because they feel like their body is stiff. And I have several patients came to me for refractory back pain, but there's nothing in the MRI to explain, and it's that body rigidity that is causing them having the pain. So the classic symptoms of Parkinson's disease are tremor, which is mostly typical for a resting tremor. We call it a pill rolling tremor. The hand goes like this. And it affects both sides. One side can be affected more. And rigidity, as like the whole body is rigid. And bradykinesia means the movement is slow everywhere. There are people, when you talk to them, you feel like they are just staring at you because they have decreased eye blink. And they move slowly. When they walk, it's like a very slow walking. There's stooped posture because the body is like trying to adjust for the center of gravity. And some people have significant balance issue, posture instability. These are the classic symptoms. Then there are a lot non-motor symptoms of Parkinson's disease, which are not very well recognized with the family or even in medical community. They do have extreme fatigue, unexplained fatigue. They could have chronic constipation, just like the slowness of the body, the bowel slow to the point that could cause a fecal impaction can cause a hospitalization. So it is very important to have good fiber diet for patients with Parkinson's. They could have autonomic problem, means they do feel like they cannot tolerate heat. The next moment they cannot tolerate cold. So that heat-cold intolerance. They could have sleep disturbances to the point they act out during dreams, like a REM sleep disorder. And certain type of Parkinsonian syndromes have hallucinations. And their voice can be very slow, and they do have trouble with the swallowing. And sometimes because of that, the pharyngeal muscles, the throat muscles are not working in coordination. You could have accumulation of the saliva in your mouth. You could have drooling, excessive drooling. Some people have a lot of kerchief or tissues. It's very disturbing and also have increased risk of having infection. Certain patients with Parkinson have abnormal posture, so their head or neck to be twisted to one side. And if they also have drooling, there is a hygienic issue and increased risk of infection. Then also can have a urinary frequency and unexplained nerve pain. So those symptoms can make their life miserable, even though we treat and the recognized symptoms. So it's a whole lot of other symptoms, including some memory problems in later stages of Parkinson's disease.